Are you suffering with knee pain? Did you know that osteoarthritis affects about 95% of the population over the age of 50, and about 65% of those patients will oftentimes have functional limitations? But guess what? You don't have to. We probably have the answer that you need to help with reducing pain related to osteoarthritis and just helping with general knee pain that tends to provide functional limitations for the majority of the population. Hi, this is Dr. Jess Sally with Regenexx Pittsburgh, your Southwestern PA premier provider of interventional orthopedics and non-operative regenerative treatments. Now, the big question with knee pain, first and foremost, is what's causing my knee pain? And there are a lot of different factors that can contribute to that. The biggest factor, as we just mentioned, is osteoarthritis. Osteoarthritis, as I said, is very common and a lot of times will have big impacts in terms of how that affects patients and how that affects patients' lives. Other factors that can also affect knee pain are things like rheumatoid arthritis, patellofemoral issues or patellar maltracking. You also have tendon-related pain and issues or ligament instability, meniscus-related pain and meniscus tears, or other types of things like nerve-related issues, peripheral neuropathy, or other things that may cause other types of chronic pain. Today, I want to talk to you a little bit about the options that we have in place for treating knee osteoarthritis and how we can help with eliminating knee pain for a large portion of the patient population. One of the biggest ways that we're treating knee pain right now are utilizing non-operative regenerative treatments like bone marrow concentrate containing the patient's own stem cells, or utilizing platelet-based treatments from the blood that help with decreasing inflammation and help with improving function. The bone marrow concentrate product that we use is also referred to as Regenexx SD, or same-day treatment. We utilize bone marrow aspirate from the actual pelvic bone to collect the patient's own stem cells and to utilize those cells in treating osteoarthritis in the knee. The most recent research that's come out about this has shown that we can help patients to avoid surgery in over 87% of the treatments that we do for up to 15 years at a time. The Regenexx SD treatment helps to provide an easy, minimally invasive option to help patients avoid more invasive and involved surgery, help to reduce pain more quickly, and also help you to get back to your more normal functional lifestyle very quickly following the procedure. A lot of patients have concerns about utilizing bone marrow concentrate to treat these issues, but what I can say anecdotally from treating patients for several years now is that most of the patients tolerate these interventions very easily. Most patients don't report a lot of pain during the procedure, and I would say 9 out of 10 times patients will get off of the table after the treatment and tell me that that wasn't as bad as they thought it was going to be. One other way that we're treating a lot of chronic issues related to the knee is our Regenexx SCP treatments. Regenexx SCP basically stands for super concentrated platelets, which most people know of in the community as PRP or platelet-rich plasma. Platelet-rich plasma is drawn directly from the blood. The blood is spun down and the platelets are taken out of the blood and used for the treatment. The platelets help with decreasing inflammation. They can help with tissue reformation in areas of like chronic tendon pain or muscle tears or other areas where there's long-standing damage. They can also be very helpful in more mild to moderate osteoarthritic change as well. One big treatment that we also do with PRP is utilizing that for shoulder rotator cuff treatments. However, for treatment of osteoarthritis of the knee, the platelet treatments have been a great option for patients who have long-standing pain, meniscus tear issues, or other symptoms that have been limiting them. When we talk about differences in what treatment option we select for patients, that tends to vary person to person. Usually what we have to do is we'll have to have you into the office to do an evaluation. We'll evaluate the stability of the joint. We'll evaluate the extent of the arthritis that you have, and we'll make an assessment with you on what we think can be the best treatment option for you. Usually if patients have more advanced arthritic change, even that advanced bone-on-bone arthritic pain, the bone marrow concentrate containing your own stem cells tends to work very, very well in treating those types of issues. And if patients have more mild to moderate arthritis or more long-standing tendon or meniscus issues, the PRP usually in those settings can be very effective as well. So a lot of the treatment decision comes down to us actually seeing you in the clinic, possibly doing an ultrasound evaluation to assess for what kinds of injuries or issues you may have going on, and to come up with a treatment plan together that's going to best serve you. So if you're suffering from chronic knee pain, don't lose hope. There are lots of options that we have here at Regenexx Pittsburgh that can be very helpful for eliminating your chronic knee pain, helping you to recover very quickly, and helping you get back to a lifestyle that you want to have and with the activity that you want to engage in.